seconds. Good morning and welcome to the Center for Disaster Philanthropy webinar on the subject Hurricane Matthew, and in particular, how can donors help? I'm Bob Ottenhoff. Hi, and I'm the President and CEO of the Center for Disaster Philanthropy. During the past week, Hurricane Matthew roared through the Atlantic, affecting Haiti, Jamaica, Cuba, the Bahamas, and much of the southeast part of the United States. We're joined in this discussion today by a panel of experts with great experience in the disaster response area. Our discussion will feature Joe Ruiz, who is the Director of Humanitarian Relief for the UPS Foundation and a CDP board member. Joe oversees the efforts of UPS to support the humanitarian community through key partnerships in the public and private sector that can benefit from UPS's logistical, financial, and in-kind support. We'll also be joined by Dr. Ann Peterson. She's the Senior VP of Programs at AmeriCares and oversees all of their programs, including emergency response and access to medicine programs, as well as other ongoing global health programs. In this role, Ann directs the delivery of more than $500 million in medical aid and relief supplies to more than 90 countries each year. We hope that Sarah Farnsworth will join us. She's the Deputy Manager for Coordination on the Response Management Team for Hurricane Matthew for the U.S. Office of Foreign Disaster Assistance. And with that, just a few reminders about today's webinar. We're recording this webinar and we'll be making this recording available on our website later this week. We're hoping to get many questions from you. You may submit a question at any time using the Q&A button at the bottom of your screen, and we'll do our best to get to all of your questions before the end of this webinar. And now I'd like to turn over the microphone to Sherry McGill, who's the president of the Jesse Ball DuPont Fund located in Florida, and the chair of the Council on Foundations Board of Directors, to welcome everyone today. Sherry, glad you could join us, and we appreciate our partnership with the Council on Foundations.
Thank you, Bob. On behalf of the Council on Foundations and Vicki Sproul, our president, I wish to welcome you all to this webinar and to thank the Center for this extraordinary partnership. We also wish to extend our deepest sympathies and condolences for the many communities that have been devastated and negatively affected by Hurricane Matthew. Members should know that the Council's legal team is available at legal@cof.org, legal@cof.org, to provide members with guidance on how to navigate the complexities of receiving and distributing funds while remaining legally compliant. It's critically important, legal@cof.org. We also encourage any of you who wish to join our disaster internet community on Philanthropy Exchange to seek and share information and advice on recovery efforts. Let me just segue very, very quickly to the situation in Florida, particularly Northeast Florida. We have joined with our partners at United Way of Northeast Florida, the Community Foundation of Northeast Florida, and the Jewish Federation to build a relief fund for immediate and temporary needs, particularly those needs of individuals and families that are not met by any FEMA or state support. Anyone interested in this part of Florida can text STORM, S-T-O-R-M, 50503 to be able to access the portal to make donations. I want to say, Bob, at the outset, the Jesse Ball DuPont Fund and our partners locally, principally the Community Foundation for Northeast Florida and United Way of Northeast Florida, have been working diligently for some months now to ensure that we coordinate our efforts, that any efforts that we engage in when it comes to relief following these kinds of disasters, or disasters like the Pulse situation in Orlando or the Dallas shootings, that we act in concert with one another, that we have pre-planned, that we know how to work with our local government. And I think one of the lessons I would share on this webinar is the great effort of the center to go to your center and access some of your materials. Some of the things that we've learned over time include, our need to rehearse and to practice, to understand who's doing what, and to make sure that we're all speaking with one voice and that we speak across foundation type and fundraising effort types, including United Way. We have lots to share, but we're on this call in an effort to try to learn from our peers. And again, I want to thank the council and the center for setting up the webinar. And so, Bob, with that, I'm going to pass it on to you.
Okay, thank you so much, Sherry, for joining us, and thanks for the update on Florida. To get a better picture, a more comprehensive picture of all the things that have been going on over the last week, we've asked Regine Webster, CDP's Vice President of Programs, to give us a status report. Regine, on to you.
Okay, great, Bob. And this is Regine Webster. Thanks for the introduction. I do just want to point out that these remarks that I'm going to offer right now are strictly about what's going on in the United States. We're very hopeful that Sarah Farnsworth from the Office of Foreign Disaster Assistance will hop on the line momentarily to talk about the work that's being done in the Caribbean by the U.S. government and the needs there. So Tropical Storm Cyclone Matthew has moved out into the Atlantic Ocean, which really sounds like a good idea. Unfortunately, the National Hurricane Center forecasts that Hurricane Matthew is likely to produce destructive impacts from storm surge, extreme winds, and heavy rains along that northeastern coast of Florida, Georgia, South Carolina, and North Carolina through Saturday. President Obama has declared that a state of emergency exists across those 4 states, and he's ordered federal aid to supplement state, tribal, and local response efforts. Millions of dollars of commodities and resources are being leveraged by the United States government being sent to Matthew-affected areas, including meals, water, and blankets. And we know that the NGO community is responding with full strength and force of the response that's available. Significant flash flooding into the Eastern Carolinas and across the region, with a focus on the I-95 corridor is of grave concern, and river crests are expected to occur in the later portion of this coming week. We know that flash floods and river flooding are of grave concern. 18 counties remain under a mandatory evacuation across Florida, Georgia, South Carolina, and North Carolina, and that means no in and no out. So this is one of those sort of no messing around evacuations. So even though, again, the storm has moved away, we're still in critical times. There are almost 1 million people across the 4 states that are without power. A large portion of North Carolina is under a mandatory water advisory, which means that it's a boil alert. So again, the situation remains grave, and there will continue to be needs emerging over the course of the next week to 10 days. FEMA has a National Response Coordination Center that's operating 24/7. The agency also has officials operating emergency operations centers and incident management teams in Florida, Georgia, South Carolina, and North Carolina. So the United States government across several agencies is giving this storm the full force of its attention. And again, the NGO community such as AmeriCares, who we'll hear from momentarily, are also responding in full force. I'll be available later to answer any questions that may arise, but I will turn it over to our speakers and to Bob now.
Okay, thank you very much. That was Regine Webster from CDP. We want to turn now to Dr. Ann Peterson, who oversees AmeriCares emergency response and access to medicine programs. And Dr. Peterson, we're especially interested in learning about the situation in Haiti right now. Can you tell us what AmeriCare has been doing, and then in general, tell us what the status is in Haiti this morning?
Sure, and thank you so much for this opportunity. AmeriCares is a global health relief and disaster response organization. We've been working in Haiti for a long time, including after the earthquake extensively. As we saw Matthew approaching Haiti, We resurrected our team there. They were on the ground, both our country director and Haitian staff, and then deployed my vice president for emergencies. So we had staff on the ground before the hurricane hit in Port-au-Prince. Since then, we have also deployed teams from Dominican Republic and from the U.S. into Haiti. If you go to our AmeriCares.org, you can see some of the videos from the earthquake or the hurricane zone in the western portion of Haiti. There are communities that our team are visiting where 100%, 90 to 100% of the homes, buildings are destroyed and not livable. Our major area of response is in getting medicines and medical supplies into countries and helping rebuild the health system. So we have about $1.6 million of medicines and medical supplies either already in Haiti that we have already shipped and received or on the way to Haiti. Our biggest concerns right now is one, having a place for our partners to be able to begin to respond to the acute hurricane needs. All of the clinics have their pharmaceuticals destroyed, so they don't have anything to respond with. We're refilling that, and we are most concerned about the already beginning to occur cholera outbreak. We had hoped it would wait a little longer, but we are already seeing both cases and deaths in the hurricane affected area. So we are sending IV fluids for the response to keep people alive, but also working with local partners. And I would say that's probably one of the most important things as a philanthropy group looks at who is responding. I believe you really need the trust and accountability of an international NGO, but there needs to be on the ground expertise. And we're working very closely with two ongoing Haitian NGOs, the Haitian Health Foundation and Hope for Haiti, and are already distributing care in the affected areas. I will also say that food and water are probably the biggest immediate needs there. It is already so bad that there are beginning to be security concerns as people are desperate for food and water and have been without it since the hurricane. That is both an immediate need we want to meet. It also compromises our ability to deliver some of the medicines and medical supplies because we want to be able to do it safely. So we're coordinating very closely with all the other NGOs that are in the disaster zone, as well as meeting with the coordination bodies, the clusters in Port-au-Prince to make sure there's no duplication of effort. And with that,
Dr. Peterson,
turn it back.
Dr. Peterson, yeah, I wanted to clarify one of the things you said. You said you've been working in Haiti for many years, and we know there are many other NGOs that have been as well. Yeah. Were your supplies damaged or destroyed by the hurricane, or do you need additional supplies because of the number of injuries?
So it's not so much the number of injuries, it's the number of healthcare institutions in the affected area that are destroyed. We are actively getting shipments, both air and ship, into Haiti. Some have already been received and some are on their way. We definitely are getting and needing very specific donations of medicines and medical supplies to address the need. One of the things that people don't realize is that there are ongoing health issues as well as the disaster-related health issues, and then the surge of waterborne diseases that we are expecting. So our first goal is to address the immediate needs, so that will be for trauma care and infection, then begin to deal with safe drinking water and all of the cholera related supplies and medicines.
And are there existing health facilities you can use, or are you do you need to be creating temporary and new ones at this point?
So it's probably a combination of both. There are some hospitals that are still standing, and they're going to be the base of operations, but there are other places that are completely devastated and will probably require tent clinics and sites, especially as we see cholera begin to emerge very strongly. The closer to the communities affected that we can get, the better we will be able to respond. Cholera moves quickly and people die quickly, and you don't have time to get them to, very far. So as much as we can get clean drinking water in to prevent the upsurge in cholera and early rehydration as close to communities as possible. And then we'll have, sort of the IV and antibiotic responses available in the hospitals and referral centers.
Okay, thanks. We've been listening to Dr. Ann Peterson from AmeriCare, and in listening to her remarks, I've already heard the word logistics come up several times, and so this seems like a good moment to bring in Joe Ruiz, who is the Director of Humanitarian Relief for the UPS Foundation, and deals with UPS's logistics and in-kind support. So Joe, give us an idea of what UPS has been doing since this storm worked its way through the Caribbean and up the United States.
Thanks, Bob, and let me just say thanks to everybody who's on the call, who's helping in some way. We greatly appreciate the coordination that CDP is providing. UPS has been working closely with the Global Logistics Cluster, which is a unit of the World Food Program, in the days leading up to the initial contact of Hurricane Matthew in the Caribbean. We've been on daily calls, getting updates from the logistics cluster, which is now on the ground with a contact in Port-au-Prince. UPS has activated its logistics emergency team. We have two Miami-based responders on call to the logistics cluster. We've been working with the logistics cluster to coordinate temporary warehousing space for pre-positioning in Miami as needed. We've been working with them in country, and we've coordinated providing our local service agent that operates in Haiti, so they now have the availability to provide ground transportation within Haiti to the affected areas in southwest Haiti from Port-au-Prince, wherever supplies are coming into. My understanding is also the ports and the airport and Port-au-Prince were not damaged, although there were bridges that were damaged leading to the areas that were most affected. We've also connected the logistics cluster with available warehouse space, which is one of the needs that they have in country. A place to put all the supplies that are coming. So thanks to the Salvation Army, which has a warehouse, we were able to connect Salvation Army to the logistics cluster. In addition, as you heard Ann say, that there's a big need for food. We're in the process of moving 3 million high energy biscuits. Unfortunately, they were sourced in Dubai, so we've airlifted those to Miami, and they're tracking to be finally shipped into Haiti tomorrow morning. We're also working with UNICEF right now. As Ann mentioned, also cholera is a big concern. We're looking to move 30 metric tons of water purification and oral rehydration tablets into the country. And we're talking with UNHCR, which they are looking to activate their emergency fund, which we provide them to potentially procure water in country. So we've also activated funds for our partners, which we do in advance so that we don't have to wait CARE has country operations that are responding to the disaster. And again, UNHCR is evaluating whether to activate their emergency funds as well. In the U.S., we're also working with our partners. We fund the Red Cross Annual Disaster Giving Program, helping them to open shelters along the eastern seaboard. They do that immediately. We're also providing in-kind transportation. The last couple of days, moving shelter supplies into Central Florida. And we're working with organizations like the Salvation Army as they need supplies. We're also working with GEMA, which is moving ice into some of the areas that were mentioned that are with extended power outages in Southeast Georgia. And again, you know, we're on daily calls with the World Food Program, UNHCR, and in the U.S. we're providing support as needed. I'm also aware that Airlink is actively trying to find air transportation into the Caribbean. We're offering ground transportation to organizations that have supplies that can connect to the Airlink flights out of the U.S. so that we can minimize any challenge if there's items that are in country and available, and we can help them get to the plane. We'll help as well. Bob, I think that's it. But what I guess what I would also say is that as a donor, I would encourage other donors to find organizations like AmeriCares that are operating in country to try to donate funding. There are also organizations like the Center for International Disaster Information, Interaction, that provide a list of organizations that are actively responding to this disaster in the country. So if you're looking to find an organization, CDP provides that service, but there are also other services that can help donors to find organizations that are actively operating in country. I would not recommend you know, organizations that are not used to international shipping trying to get supplies into Haiti. Is one of the most difficult countries in the world to try to clear customs. You need to be working with a UN agency or a very seasoned NGO to do so. And Bob, if there's anybody that would like to talk more, I'm glad to, you know, provide any consult I can after the call.
Good. That's good to know. That's Joe Ruiz, who just made that offer. He's the Director of Humanitarian Relief for the UPS Foundation based in Atlanta, Georgia. Joe, so would you, it sounds as if you're able to get supplies into where you want to get them. It's just a matter now of getting them there. But in previous disasters, I know the earthquake in Haiti, distributing goods was a big challenge. Is that less so in this case?
Right now, again, we haven't. We're looking at tomorrow morning. We don't anticipate any problems getting the biscuits into Port-au-Prince. The earthquake was a bigger issue because at that time the airport and the ports were both damaged. I think in country getting supplies to the impact areas in Southwest Haiti will be more challenging. I know the World Food Program is setting up helicopter runs to the affected areas because some of the roads have been impacted and the bridges have been impacted to get to the areas hardest hit. But Port-au-Prince was not, you know, they got rain, but they were not hit as hard as during the earthquake in 2010.
So just a reminder to all of those listening, you can submit a question at any time using the Q&A button at the bottom of your screen, and we'll try to get to your question as soon as possible. A question to both Ann and to Joe, and we'll start with Ann. Should we as donors be thinking about are the immediate needs being met, the relief efforts being met, or is this still an ongoing challenge? And first to you.
Sure. So yes, I think it is still an ongoing challenge. The food is just starting to get there. The roads are just starting to get opened up, and we're beginning to get it to the first cities in the affected area. But there are communities inside and between Jeremy and the other points that have not yet had anybody get to them and bring them any food or water. So there is some significant need that is still out there. I would put food and water first. We're a health organization, so we're trying to follow very, very quickly along that line. We are getting distributions out into the area by either helicopter or by truck. The transportation is difficult, so they are smaller amounts than the need. There are still tens of thousands of people who don't have a place to stay or ready access to food and water. So we're only at the very beginning of seeing the amount of need. The logistics is very significant, so that needs to be stepped up to larger scale. At least it's open, but we need to really increase the scale. I know that making sure that the distribution is equitable and fair is going to be a challenge. Those who are most able are likely to be the ones who get to the food and water and medicine distribution sites. So the responding agencies, and especially the local on the ground NGOs who really know their communities, are going to be key for getting to the places where you have women, children, elderly, and disabled who need care.
Joe, do you have anything to add to that?
No, I agree with Ann. I think it's the urgent needs are still, they're just now trying to get to the people. So there's been a good week that people have gone without, and again, I would recommend for donors out there that the most impactful way to support this is to provide monetary donations to agencies that are actively in country, because then they can help procure those items that are needed closest to where the people are, and they can help the local economy of the businesses that are actually there in country. But most importantly, it'll be much faster to get that water if it's procured in country and delivered locally.
If I could add to that, I think we're trying to source as much as we can for exactly those reasons within Haiti. But the other key piece is that the coordination mechanism that Joe's been talking about is really important to help each of the different responding organizations know who's where, which groups of people have been taken care of, and which areas still have significant need. So that's takes a lot of time and effort, but it's actually going well. And it's one of the reasons why funding makes a difference to get it to the organization so they can do the local purchase and the local transport, as well as coordinating and getting the supplies shipped from the U.S. to Haiti.
One last question about the Caribbean and Haiti in particular, and then we want to go and talk about the rest of the areas hit. And Regine, maybe you can get this started. We've been hearing now for several years that the international aid community and by extension the disaster community needs to pay more attention to local NGOs. And we've now heard that from both Ann and Joe that they're trying to do that. How do donors get involved in that if they want to provide some extra support to a local NGO? How do they do that and at the same time have some comfort that they're giving to organizations with the right capabilities and capacities?
You know, there's several different ways that you can do that, Bob. Way number one is what we always champion at CDP, which is to say, have pre-existing relationships with organizations on the ground, so that in the wake of a disaster, you're not developing a new relationship. So for instance, Anne referenced several of the partnerships that AmeriCares has had with on-the-ground organizations in Haiti, and they've had those relationships for years now. And later you can tell us how many years you've been working with those local Haitian organizations. So develop relationships in advance. Option two is to work through an international nonprofit organization, such as CARE, Save the Children, World Vision, AmeriCares, the International Rescue Committee, the International Medical Committee, any of those organizations. You can work through them, and as you plan your gift, plan your grant award, you can ensure that those dollars go in part to the international NGO and then in part to the local NGO. And then you can certainly call us at CDP and use us as a resource to help develop a relationship or help investigate and research those local on-the-ground organizations. I'll say domestically, to support local is fairly easy. And I would say it either starts with a quick call to us over at CDP or to work with your state or local VOAD. VOAD stands for Voluntary Organizations Active in Disaster. So the VOADs operate nationally, locally, and at the state level. And they're a membership organization comprised of all of the responding organizations domestically. So you'll see food banks, you'll see Salvation Army, you'll see the American Red Cross, you'll see Presbyterian Disaster Assistance, Catholic Relief Services, Catholic Charities domestically, and many, many other organizations. And so working with your VOAD ensures that you can then get much needed dollars to each and every one of those local NGOs.
Okay, thanks very much, Regine. This next question is to all of you, but the question is, so now we're moving to our focus to the United States, and we want to learn a little bit about what's been happening in Florida, South Carolina, and North Carolina, and Georgia. And this question is, what American Southern communities have done relief efforts really well? Any of you have some thoughts about that?
This is Ann Peterson again from AmeriCares. We also respond in the U.S. We're not just global. And so one of the first things I would want to do is just really applaud each of the governments within the states who got the evacuation going very promptly, and all of the people who responded to that. We're working in the, again, in the health space, but specifically, we most often in the U.S. work with health clinics, free clinics who provide care to the poor, and in the case of disasters, state health departments. We've done a lot of work on disaster preparedness with our free clinic and federally qualified health centers to help them anticipate need and be able to respond quickly. Hurricane Matthew is the first time post-training where our free clinics have had a chance to put into place what they have learned in the disaster preparedness programs, and they responded really well, so that they not only made sure that they had on hand what they needed, but were able to open up and begin to provide services again pretty quickly for the populations in need. So I think that's good. The coordination is getting better, and we know what are the immediate needs as well as the longer term needs. One of the things that gets forgotten on the health side is, especially in the US, but also elsewhere, is that when people evacuate quickly to avoid a disaster, as has happened with Hurricane Matthew, they don't know how long they're going, but they often forget to bring their chronic disease meds. So our diabetics, our hypertensives are in evacuation shelters and may be days without having the medicines they need on board. And so reconnecting them with that life-saving medicine quickly enough needs to be done, and it's happened better in the response on this disaster than it has previously.
Bob, this is Joe. I think everything that Ann said is great. I also just wanted to say from a donor perspective that I think donors are becoming more savvy and understand that it's okay to reserve some of your funding for long-term recovery needs. And more and more, I'm hoping that organizations will, I guess, budget out when they're looking at a response to a disaster, both immediate needs and also long-term needs, and working with organizations that support long-term recovery efforts. We're starting to put more and more of our support in building a portfolio of responders that support long-term recovery. So while I know that there are many urgent needs going on now along the Eastern Seaboard, there are going to be many needs over the next 30, 60, 90, 120 days, and even beyond for recovery. So it's okay for an organization to hold back a little bit. There's a lot of pressure on organizations to announce and respond immediately what they're going to do in the first week. But it's okay to say we're gonna do this now, and we're gonna reserve this budget for long-term recovery needs. We don't know what those are yet, but over the next 6 months, we'll be announcing those. And I would encourage corporate donors to do more of that. But also, it's okay for private donors to look at those options and work with CDP to help support some of those long-term needs.
I couldn't agree more.
Joe brings. I wanted to ask a follow-up question with Regine. So Joe brings up a good point, which is that we're just now beginning to hear about the long-term impact on states like North Carolina and Florida, and then countries like Haiti. One of the concerns that we often hear from donors is about the role of FEMA and how that then integrates with the role of donors. So give us a little idea. What do you think? We wanted to get someone from FEMA, I noticed, to be on this call today, but they've been so busy in both Louisiana and now the Southeast that we weren't able to free someone up for this particular call. But what do you expect FEMA will be doing in the next few days and weeks? And then where does the philanthropic community intersect or coordinate with the role of FEMA?
Yeah, I mean, you're absolutely right. FEMA is incredibly busy right now. And they have, as I mentioned before, they have emergency operations centers open, which means that they serve as the hub and spoke for all information coming and going between affected individuals, organizations who are on the ground helping with the flood relief efforts, flood and storm relief efforts, and then also ensuring that federal dollars are directed toward affected individuals and affected communities. And again, they do that. Just as I had mentioned about the NGO community, they do that they go state by state, community by community to address all of the needs. In terms of the philanthropic response, I'll just echo what Joe said, which is to say, keep your powder dry. The recovery needs, just as Ann was saying before, we don't even yet know the full scope of the needs, be it in the Caribbean or domestically. And this storm system is still wreaking havoc, as I said earlier, on the eastern coast. So there's plenty of time for the philanthropic community to understand where the gaps in services are and then plug their financial resources in those holes to meet them. So for instance, if we find out that domestically there is a need for disaster case management, or if there is a need for childcare, then those are two areas where the private philanthropic community can zip right in and support with additional funding or backstop. There's more and more activity within FEMA to liaise more carefully and more creatively with the philanthropic community, and in a way that the resources, allow me to say the word leverage, I'm sorry, in a way that, governmental resources as well as private resources are leveraged more fully, which means, in my view, that, a little bit of federal dollars, a little bit of private philanthropic dollars means that the funding actually goes much farther than it did before. So lots of good stuff going on.
Yeah, and if I can make just an add-on point, this is a classic example. You've got this major event, Matthew, which is hit on the heels of the significant flooding in Baton Rouge. So what happens in Baton Rouge? We don't want people to forget about the long-term recovery in Baton Rouge, which is typically what happens. So there will be opportunities with Matthew for the long term, just as Louisiana is now looking to create a long disaster recovery alliance. So there's an opportunity to think of not only how are we going to respond to this Matthew currently, look at its long-term needs, but again, not wanting to turn away because of the newest event, and not to forget that there are certainly and currently significant long-term recovery needs in Baton Rouge, in South Carolina from last year, and that's the challenge that we face. Corporations and businesses and donors have short memories, and the media tends to focus on the new. So, but I appreciate the folks that are on this call. I know are sophisticated and understand that having a balance between immediate and long-term needs is really important.
I would just also echo, if we think about even South Carolina, the flooding they're facing now is coming on top of a lot of recent flooding. Haiti, this is, the second major disaster. And the long-term funding allows us to not only meet immediate needs and those interim, but fill the gaps and then also do some of the rebuilding. We count on, as an NGO, and I know this is true of many NGOs, that within the first 30 days after a disaster, when most of the philanthropy happens, that gives us sort of our funding envelope for doing the rebuilding. The longer, later funding is extraordinarily helpful, but the attention is still fairly limited. If I could get funding for 2 to 3 to 5 years, even in the U.S., if we think how long it took to respond to Katrina, we're expecting the floods to have mold impacts and rebuilding for all of these communities. Same thing is true for Haiti. And so I would really seriously echo the need for the long-term funding, but for planning, at least the NGOs also need to know sort of what's our envelope that we're going to be able to work within. I will be able to do much more in both the U.S. and in Haiti if I know what monies are eventually going to be coming in. Our farmer donors, I will just say, have been fabulous. They're really good at the sort of wait and see, where do you have need, what is it that you still need. In Nepal, we managed to get a whole second round of medicines and medical supplies into Nepal and restocked a large portion of the country about 6 months after the Nepal earthquake because of the needs there. So I would just echo what the two previous, Joe and Regina had said about the need for that from a philanthropic standpoint.
Regine, going back to FEMA for just a minute, can you remind all of us in general terms, not get into the specifics, but in general terms, what does FEMA cover and what don't they cover in something like what we're seeing in the Southeast? And is there any question that FEMA may not declare some of these affected areas to be disaster areas?
Bob, I'm actually, I think better than the answer that I could give, I'm going to refer people to a blog by our colleague, Nancy Beer, that really looks deeply into the different types of disaster declarations that that FEMA awards. And so maybe we should send that out to all of our participants at the end of the conversation. I don't believe, and I may be off, right? It is almost 11 a.m. Central Time, and I haven't looked for a couple of hours. I'm not sure where all of the the FEMA declarations rest at this time. So we can get back to you all at a later date.
Okay, good. Thank you for that. But I think the point is that there are some things that FEMA covers and some things that they don't. And as a donor, we want to make sure that we're filling in the gaps. We're doing the things that that are difficult to fund, and things that are beyond what a government agency like FEMA is able to do. So, Anne, let's go back to you and kind of get the big picture. And I'm wondering, how does an organization like yours, I guess, differentiate, or do you, between the short-term needs and the long-term needs? It seems like in a place like Haiti or a place like in the Southeast United States, there are going to be many short-term needs, but then you're also referencing, exposing, talking about needs for many days and perhaps years to come. So how does an organization plan for something like that, and how does it how do you balance those tensions?
So I'll start with the U.S. I mean, there are many people and many organizations, including FEMA and local government, that respond in the U.S. So we differentiate ourselves and focus our efforts to be the place where other people aren't working. So in the immediate disaster, we go in and we find, do needs assessment always, and find what places need supplies and commodities. We're really good at logistics, at getting these things to them. And often that means restocking medicines and medical supplies in the clinics. When we go to rebuilding, we will probably narrow our focus, and we'll focus more on the free clinic space. And there are still 11 to 17 million people in the US who are regularly served by free clinics, not by Medicare, Medicaid, and they're not insured. And so we work in that space of 950 plus free clinics and help them continue to respond. And so that's there are very few organizations that work at enhancing that niche and their care and service. I will say that we also have specific areas that we focus on thematically. So chronic diseases, which is huge, doing it for that same free clinic space, and more mental health. When we go to the international, it's the same kind of thing. There are many organizations that respond. We're a global health organization, and so we focus on, in the urgent, what is the health system and what are the health issues people need immediately, and then what health systems rebuilding needs to happen. Sometimes that means rebuilding a clinic, doing walls and bricks and mortar so that there's a place for services, or restocking, but it can also be, how do we build the capacity for those health systems to continue long term? And so we more and more focus on the things that others are not doing. And internationally, we are doing mental health, psychosocial, how do people respond from the trauma, both the health workers and the patients that they serve. So that's how we both become part of the larger response, but also focus our areas to meet needs that aren't being met by other NGOs or government agencies.
Okay, we've only got a few minutes left, and so I want to ask for some closing comments from each of our participants, and I'd like to include Sherry McGill in this as well, and give you an opportunity to talk a little bit about Florida and the areas around and your adjacent neighbors as well. And my question is this: we're hearing today stories of lots of death and destruction. We're also seeing this. We heard from Regine's comments is that this story is not over yet. That the storm continues. The impact of the storm will be with us for many days, and the long-term impact of this could take months, if not years, to fully recover. So given all of those demands and given all of those needs, what advice would you give to a donor who may be listening today? What should be their priorities? How do they go about this, since it seems at times a list of overwhelming choices? And Sherry McGill, let's start with you from the Jesse DuPont Foundation in Florida, and then from there we'll go to Joe Ruiz and Ann, and then Regine, I'd like you to wrap it up.
Yeah, Bob, thanks very much. This is Sherry. Again, we appreciate all the good information on this call. I think our experience locally and throughout the Southeast, quite honestly, has taught us as a donor that our space really is the immediate need space and the intermediate need space. We do a lot of work around housing on an ongoing basis, which is a long-term need. I think in terms of Northeast Florida, our fund that we just established with the Community Foundation, United Way, and Jewish Federation is really designed to help individual and corporate donors to have the confidence that we are working together as a community. We're not competing with one another. We've got one portal to which people can contribute. We've got our frequently asked questions up online so that people understand exactly how the money is being administered, what kind of needs are eligible for this. Again, we are talking about needs that FEMA will not meet or cannot meet, that the state will not or cannot meet. We're very cognizant of the financial health of our not-for-profit sector, those social safety net organizations. So we are engineering that money toward that network of organizations that by definition meet individual and family level need. I think some of the longer term challenges for us, quite honestly, we're getting reports just this morning about our sewer system in Florida. You know, this was a storm surge event for us. We have no idea. I think city government doesn't yet know, and state government doesn't yet know what that long-term need is going to be in terms of our basic infrastructure. So when you all talk about mental health needs and physical health needs that are at the individual and family level and neighborhood level going forward, I think it's something that we're cognizant of. But Bob, at this moment, we don't know what that need looks like. Financially, we know that, you know, we've got over $2 billion worth of physical damage, but we don't really know the extent of that. I think we are deeply concerned about people who live in rural space in the 6-county region. They are hard to identify. So many people live in substandard housing to begin with, where there's not a lot of infrastructure. So one thing I would add to what we've heard before is to think about, for donors to think about legal aid needs of people who are skeptical, quite honestly, about public relief or government relief. We learned this in Alabama after the tornadoes. The people who live in rural space in the South don't want to apply for aid via FEMA. And in that case, legal aid was, did yeoman's work in terms of going out and volunteering to help people understand what the FEMA process is, if the FEMA process is actually enacted in some of these places. So again, to answer your question specifically about what donors ought to think about, is look for those reputable organizations. Again, in our space, donors have come together to create one vehicle to which people can donate. We don't expect that everyone will do that, but I think we've worked very, very hard to make sure that we're working with credible organizations. Reputation is important. We've worked very closely with our mayor. This is a joint effort. You know, Florida is a place where we get a lot of scam artists because we have such an aging population. So we know donors can be concerned. So I think the funding community, the organized funding community ought to work very, very diligently to increase people's confidence. Transparency is a big thing, reporting back to folks, again, making sure folks know where the money's going and what kinds of things we'll support. I think that answers your question. Again, you know, we appreciate the opportunity to participate. And again, on behalf of the council, Bob, we appreciate the partnership with the center.
Thank you, Sherry. Dr. Ann Peterson, how would you answer that question about what should donors be thinking about right now?
So I guess my biggest message is, you know, to choose the issues that are important to you or your organization, and then really stick with those issues in the organization. As I look at response to disasters, the place that the time we're most effective, and other organizations as well, is when we have funds in advance so we can be prepared in advance. Both in the East Coast and in Haiti, we were able to deploy teams before the hurricane arrived. We do this all the time, so we anticipated what the needs were most likely to be, so we had at least some of the core things ready to go. And so for a donor to work with us so that we are actually able to get in there ahead of the problems and then assess the needs and then respond quickly and long term. So stick with the issues. Figure out whichever organization you really want to work with that's doing the kind of work you're doing, and then help them get prepared and then stay with them long term. So thank you. I mean, we couldn't do this without all of our donors.
Joe Ruiz, what would your advice be?
Bob, I would just say donate responsibly. You know, building partnerships ahead of disasters is always a great way to go. Try to look and tie to your strengths. If you're a corporation, what can you do? If you're a legal firm, how can you provide legal services, as was mentioned earlier? If you're a technology firm, how can you engage in response recovery? Or health firm, how can you connect? There's a lot of different things that organizations can do besides monetary donations. But I do want to say for individuals to please refrain from just cleaning out closets, and agencies are not set up to handle and respond to those types of donations. There's an organization called good360.org that posts the specific needs of organizations active in response. They work closely with the National VOED and other organizations. So individuals can donate cash and corporations can donate product to those organizations, and they will match it to needs of agencies and emergency operating centers and states that need that have specific needs posted. So that would be my my closing comments. Donate responsibly.
And finally, Regine Webster, what would your recommendations be to donors listening today?
Well, I've heard our speakers talk about, you know, staying issue focused, staying cash focused, working with pre-existing partners. And so I'll wrap on top of those three really, really strong suggestions by encouraging the funding community to think long term. This is not a disaster, again, either domestically or internationally, that's going to go away in a week. It is going to take years to recover from this type of a disaster, and communities, families, individuals, businesses will be affected for the entirety of that time. So I'd really encourage the funding community to look at the medium and long-term public health needs, the medium and long-term mental health needs, shelter needs, small business and livelihood needs, and the myriad of other needs that are going to continue 6, 12, 18, 24 months down the road.
Well, thanks, Regine, and thank you to all of you for listening to today's webinar. I want to say thanks to our guest, Sherry McGill, who is with the president of the Jesse Ball DuPont Fund and the chair of the Council on Foundations, Dr. Ann Peterson from AmeriCares Emergency Response and Access to Medicine Programs, Joe Ruiz, who's the Director of Humanitarian Relief for the UPS Foundation and a CDP board member, and Regine Webster, who is CDP's Vice President of Programs. I want to also say thanks to our colleagues here at CDP, Jenny Anvari and Anna Hurt, for their help in producing this webinar today. And if we didn't get to your questions, or if you have other questions or thoughts, we here at CDP would be happy to speak with you. So thank you all very much for attending this webinar, and have a great afternoon.